All right. Good afternoon, everyone. Thank you for joining the Winter Support Partner meeting. We are very excited to have everyone here. Just want to thank our HILT captains. We've got Angie Graves and Stacy Lopez, and it looks like Wendy just joined as well. So thank you, Wendy, for joining. In addition to everybody else, we really appreciate that everyone kind of comes to these meetings afterwards. We're going to be doing a few different things here. We're going to talk a little bit about sound careers in healthcare, just a smidget, just for any last minute requests. And that will come over from Wobbs, from Christina. And then we're going to dive right into kind of the quarterly meeting. We'll do a highlight of some of that conversation, and I'll be showing my screen with some of the slides just to kind of re-energize some of our conversations, and then we'll dive into the conversation as well. So really fantastic presentation. So I'm going to go ahead and share my screen. And if you also want to go ahead and introduce yourself into the group chat, that'd be appreciated. And I did get a good recommendation from someone from the quarterly. They asked if people, if you wanted to share your emails, because one of the things that we do is we do share the chat, but if people don't have their emails in there, then I guess it might be a little harder for everyone to kind of stay connected in that sense. So if you're able to do that, that'd be appreciated as well. So I'm going to go ahead and share my screen. All right, I'm sharing my screen. If you're using multiple screens there, you'll see that. And what we're looking at really is, kind of starting out with the Talent Pipeline Committee updates. And I'm going to go ahead and ask Christina to come up and talk about these updates and any final ask. As you know, we have the Sound Careers in Healthcare that's coming up on the 21st. I get a little nervous when I think about it, just because there's so many moving parts, but there's lots and lots of excitement and support. And so, Christina, are you able to talk about this slide?
Tatiana is actually going to be presenting.
Okay. Tatiana.
Yep, I'm here. Hi. Yes. So really good news. Just in terms of sound careers, we are reaching getting close to reaching some of our volunteer numbers. So that's really exciting. Some of the goals. But we do have one call to action, which is that we still need a few logistics volunteers. So if you guys could please reach out to your networks and just ask if anybody is willing to just kind of like help out, with logistic roles. And so that includes things like student guides, transportation, and food guides, registration, and check-in assistance as well. We are completely capped with tabling and activities. We cannot have, and we don't have any more space to include anything else. And so I have had a couple other registrations that have come through in the last couple minutes. I just wanted to make the announcement that if your network is asking for a table for their organization with any new registrations, we unfortunately cannot accommodate that request at this point, but we can assign you guys to logistics, so that would be really helpful. So that's the big update that we have there.
Tatiana, can I ask a quick question?
Sure.
If there's any colleges that need our space that are requesting exhibit tables, let me know, okay?
Okay, yes.
Because we're referring like a ton of colleges to exhibit. We probably have referred 6 in addition to those who have already initiated on their own. Anyways,
okay, yeah.
And we're happy to share space with our space that we have is the Allied Health Center of Excellence.
Okay, awesome. Thank you so much.
Thanks, Dan.
So that's the big update that we have just in terms of like call to action. So like I said, please if your colleagues and other people in your network are interested in just like helping out, just giving helping hands for this event, that would be incredibly helpful. We are actually having more students, or we have more students that are confirmed for attendance than we had originally planned. So all of the extra hands available will be great to have around. So that's about that. And then what other updates did you want me to go through real quick, James?
Financial sponsorships. We are always accepting additional financial sponsorships. So if you have some funds around, we are still looking for that last bit. I think it was right under $5,000 to make sure that we have all the resources needed for this event. you know, there's been a few conversations about, you know, should we charge for this event or do anything like that? And we want to keep it obviously free and accessible, not only for students, for all the healthcare professionals and organizations and agencies, especially to come and obviously give that good information to the students who are eager. I'm always so pleasantly surprised that students stay eager for healthcare because, you know, it's not easy work. You know, it's definitely something that kind of pulls you in a lot of different directions along with taking care of people. That is not easy work. So any other updates from WAPS? Just want to make sure and give that space.
Nope, I think that's kind of what we got going on right now. We are trying to we're finalizing all of the volunteer assignments for the ones who have registered. We have orientation materials going out to tabling and occupational activity participants. Those will be going out tomorrow. So if you guys keep an eye out for that, and then orientation materials for logistics volunteers will be going out early next week on Monday. So
all right, and then showing up at 7:30 in the morning on the 21st. So we're very excited. So if you haven't signed up yet, please sign up for that logistical volunteers. And Tatiana, if you could put that in the chat, that would be fantastic. Perfect. Thank you.
Of
All
course.
right. Any other final questions for sound careers in healthcare?
James, I see there was a question about how much in total have we received in sponsorships?
Okay.
And so to date, we've received 23,500 in sponsorships.
Terrific.
Thank you.
Great. Thank you.
And we're still a little less than 5,000 short of our goal. So again, James mentioned if your organization is able to be a financial sponsor on this slide, you can click on the scholarship tiers information there, and you can send myself or Tatiana or James that an email and let us know. Thank you.
And thanks for clarifying that. So when James was just mentioning around the financial, he mentioned the number 5,000, and that's how much is still needed. Not in terms of what they were looking for. So in total, what you're hoping for was approximately $28,000 to $30,000.
We had a little bit of funds that we were starting with from last year that were left over that kind of helped get us jump started with, you know, getting some supplies and getting some things. But our total, the total amount that we were looking to raise this year was about 30,000, around that number.
Great. Thank you, Dan. Thanks for the question. All right. Any additional comments regarding sound careers in healthcare? All right. Well, if you haven't already, make sure you sign up to be an event volunteer. We are excited. It's going to be a fantastic event. Another one, another win for us this coming year, and we are excited. So as I mentioned, we're going to kind of go over the presentation a little bit, just kind of talk about some of the highlight conversations. And this is really meant for you to be engaging. If you have a comment that you want to add in, please do. You know, but we had a fantastic presentation from Kelly Pultz, who's the regional administrator for Western Region U.S. Department of Labor in the Women's Bureau. And just to give you a little history about myself, so if you didn't know, I was an LPN in the U.S. Army Reserves for probably 10 years, and so I do have some nursing experience in healthcare. And when she was talking about some of the stressors that people face in healthcare, particularly women, I was just looking at it from the lens of I remember the stress that I felt just from my experience there, and I'll open it up also to other healthcare professionals here, but it's not an easy role, right? When you're there, helping the patient and you're dealing with the family who are stressed already because the patient is either doing well or not well. And then you've got the physicians and you've got kind of this whole system in healthcare that's going on. But she really highlighted some of the need that we have regarding her presentation about gender-based violence. So the title that she had was Preventing Gender-Based Violence and Harassment and Supporting Midlife Women as Retention Strategies in the Healthcare Workforce. And she really paid a good attention to the menopause and periods that women experience in healthcare, and also talked about some strategies as well that we could do hopefully in support of that. So just kind of talk about some of the highlights here. She really talked about the Women's Bureau and some of the purposes. And obviously, they do research and policy analysis, grant making, and education and outreach. So if you ever had a need for her to come do a presentation with your group, I think she was really open to do it with us here at the HILT. And so she's definitely accessible and obviously there to help educate people regarding some of these areas here. So their priorities really for the Women's Bureau is to, eliminate the persistent gender wage gap. So we know that historically, women have been paid less over time, for their work that is really comparable to any other person's role. She did mention that that was even kind of a law way back then, and then obviously some of the additional laws have been embedded to help rectify some of that inequalities. And then, of course, there are other priorities, reducing caregiving penalties for women and low-paid workers. So this was kind of brought up because a lot of times women are having to do extra roles in the household or even care for elderly parents. And there's just a lot of those social and kind of expectations of particularly women to kind of fill in for that role as well. And then, of course, the other priority that they work is eliminating gender-based violence and harassment. And that's really where a lot of her focus was towards the end of her presentation and really looking at some of the discrimination that happens. And they use the term the world of work. And in that world of work, that really is encompassing of a lot of everything that has to do with work. So it's not just being at the workplace, but also, an example would be like traveling to and from work or being at a work function or something like that. So anything that had to do with that is kind of eliminating any violence in those areas as well. So when we looked at eliminating the persistent gender wage gap, it was once again looking at that unequal pay. And, and I know we have some experts here. And Angie, I'm kind of looking to you since you kind of have this regional expertise for us. And, if you're not aware, Angie, and I'll let you, Angie, kind of explain that, but Angie works with multiple states along this area. And Angie, I don't know if you have any, anything that you can add on to this part about just kind of equal pay. Maybe you saw it maybe historically, more so in the past than you have now, or just trying to look for any kind of additional comments that you might have.
Oh, thanks, James. No, happy to comment on this. I think it is a national issue, and definitely a problem when we look at that wage gap. I do believe that because it is more common it's not as discreet anymore to talk about, gender differences and the impact of gender differences. And so I do believe that there are a lot of organizations, I know Kaiser is, and I know there's a number of others as well, that are really paying attention to this and trying to get better at it. I'll say there's still a significant, there's quite the pathway to still continue down, to get it as narrow and frankly non-existent, which is ultimately what would be ideal. So there's still some place to go, but I am seeing, just in various organizations that I'm talking to, and then across our organization, progress, I guess is the best way to put it. So long ways to go, but we're, at least there's more efforts now than there used to be, which is good.
And Angie, I think you said such a key word, progress, right? So there's obviously that historical part to it. There's the work that we're doing now, and obviously there's still a lot to kind of still happen in that space. So I'll kind of open it up a little bit for any additional comments regarding this. We all kind of have our experience that we have in the past, whether that was, pay related or some unequal expectations of work. Does anyone have any additional, either examples or anything else to add into this particular, topic regarding, wages and pay and working conditions?
James, I'll just mention that one of the things that we're drawing attention to at the National Center for Interprofessional Practice and Education, which is hosted at the University of Minnesota in Minneapolis, is this issue of essentially asking the question, who does the most touch in healthcare, or who gets paid the least? And who often gets not asked to come to the table when it comes to education around team-based interprofessional practice. So we're trying to elevate that conversation at the national level by making sure that larger universities are paying attention not only to invite doctors and pharmacists and nurses to the table, but to pay attention to those who are working in community health, home health, lots of other professions who don't frequently get included or invited to that table. So anyways, so it really kind of fits in with the same theme here, at least from my perspective, it does.
Yeah, sure. Thank you, Dan. Thank you for those good comments. Yeah, and one of the things that she noted as well is, kind of that historical part of where a lot of women historically were not in positions of those high-paying jobs, right? So sometimes like the board or the CEO of a large company or something of that nature, and that's historical. And we've seen some of those changes, but when you look statistically, we know that there's still inequalities in that as well. So yeah, it was a great presentation on that. And one of the things that she also highlighted was the 8 principles of a good job. And, we'll kind of look at this list and want to see if anybody has any additional comments regarding this, but, not only with recruitment and hiring, but also, she talked a lot about the organizational culture and, whether, women have easy access to laboratories, right? If they need that, or having some flexibility with their work schedule. Let's say they're going through an episode that is not really letting them work to their most efficient, level, and then just having some flexibility with, the people that you care for at home. I know, when I was a kid, when I was sick, my mom would have to call in, into work and not go to work. And so that was kind of, I don't think I understood it from this perspective, but I do remember my mom always being there and being that person that cared for me. But, they talked a lot about that flexibility at work and what is that culture at work that someone could, say, hey, I got to take it off and not being penalized or getting some kind of negative experience from that. When we look at here, what are the areas that kind of glean out to anyone? What are the areas that seem, really relevant in your area? And I'm going to look towards Stacy, because Stacy, I know, is a leader in behavioral health. And I think that's such an interesting part, right? Because I mean, when I look to Wendy, I see in my mind, I see, hospitals and medical, and Stacy, I see behavioral health. And to me, they're similar, yet they have such differences. I mean, so many big differences. So Stacy, is there anything in here that kind of, gleans out to you as either something that y'all are working with or working on, or, any kind of context that you can look at in kind of this list here? And once again, these are the principles of a good job, right? So how are we addressing these in our areas?
Yeah, thank you. And I think it's a really important conversation in behavioral health because women are overrepresented, right? Women are a vast majority of the behavioral health workforce. So I think these are things that we focus on at Sound, trying to be the best possible workplace for people. One of the things that we have really leaned into is sort of that empowerment and representation, as well as working conditions, in that we have worked really hard to allow people flexibility so that they can manage their lives and their jobs. So we do a lot of letting people work like slightly different hours. We let people sort of go up or down from if you're one full-time employee and then something happens in your life and you need to be 0.8, we say, okay, and we make that happen, and you don't lose your benefits. We also work very hard at creating career paths in behavioral health. Given the workforce shortage, that's one of the ways that we cope, is that we try to grow our own. So we are always looking at skill development and how we grow people both through skills, talents, and credentials. Which is sometimes getting the actual credential is harder. It's easier to support people in growing their skills and talents than actually getting some of those actual requirements for DOH. But I think if we could nail all 8 of these, we would have a stable, happy workforce. We continue to struggle, as probably do many folks, with pay in the behavioral health space. So
Equal pay for men and women, like women and men, like, is that what you mean? Or just
No, just pay.
Okay, just pay. Yeah, gotcha. Yeah, yeah.
Yeah.
No, I understand that. Yeah, I also have a bachelor's in psychology, and I remember when I graduated, the pay was not there at all. I was like, there's no pay, and we're still kind of struggling with some of those. So yeah, I agree.
Mhm.
What else comes out to people here, from these 8 principles? I mean, what stands out? What are things that you're working with in your organization? What are areas that you have a keen interest in? What would be something you would change? I mean, what are the ideas?
James, I'll jump in. This is Wendy.
Absolutely.
And I think I would echo a lot of what Stacy shared. And so a lot of what was coming up for me as well. We think about, and reflecting on the presentation, I think it was shared that 75% of the healthcare workforce nationally is female identifying. And at children, that number is 77%. So women are overrepresented as we think about representation, right? And as we think about supporting different employee populations. We haven't necessarily had overt strategies geared specifically toward women. Because we're an organization, almost 3/4 of us are women, and so we're just those strategies are kind of applying to everyone. As I look at this slide, I think I'm proud of the work we're doing in most of these areas. I would say the working conditions space is probably where we have a lot of room to improve and grow as it relates to the lens on older and mature women in this menstruation and menopause space. So that is what is resonating for me.
Terrific. Thank you, Wendy. Yeah, I really appreciate that. And you definitely brought up the older women in midlife, which we'll go to in just a second. But Pat, I see your hand up.
Yeah, I will second that, Wendy. I feel like I'm really proud of the work that Washington Association for Community Health is doing around these 8 principles. We're doing a really great job. We have twice a month DEI trainings over lunch. Basically, they're called lunch and learns. And I think it's probably the most equity focused organization I belong to, and that really keeps to their equity training has kept to their equity training on the long term. So each, 2 times a month, someone picks a topic and is willing to present, and it's a very safe environment to talk about your feelings. And that is probably something that I've really appreciated about Washington Association. I don't know how we do it, because I've been in other organizations where people stop talking. It becomes very uncomfortable. But I think there's just been the messaging that we stay open-minded, that we stay thoughtful in our responses. And so it's been really, really positive experience for me in the last 2 years. But I also will second that when it comes to, this was the first presentation I heard around ever talking about women in menopause. And, women over 50, especially, and those safe places to be. And I think it's largely due to the fact that women just deal. Like we're just like, no matter what's going on in our lives, we just kind of we keep powering through. But, until you've been there, you really don't understand what women in menopause is like. Right. And we've just been dealing with it, and we just keep saying yeah, we can cope, but there's larger increases in depression, in anxiety, in, just the ability to cope, the physical aspects of it. And that's never been addressed anywhere I've been. So I was very, just almost honored to hear that someone was finally addressing that. And, if you bring it up in a group full of, people of different age, how can you expect them to understand? You just, until you're going through something, you really don't get it, right? And so I just thought it was a great topic. Really, I want to hear more about it, and was, very thankful that it had kind of risen to the top for this topic.
Yeah, Pat, thanks for sharing that. You had not heard these conversations, before, because I think sometimes I look at it from a male perspective, and I'm not always, paying attention enough, I guess, in some of these areas. But it's really enlightening to see that we are kind of talking about it, as you mentioned, and not only in healthcare, but we've heard some of these conversations even in maritime, because that's another industry that's really has some inequalities for gender based.
And I will say, James, the shoe on the other foot I think there is such a thing as menopause, and I think people should start definitely talking about that for men over 50, because it's real. The struggle is real.
Mm-hmm.
I'm hearing a lot of so yes, yeah, thank you. And I saw that Tracy, I want to say you had your hand up. So if you want to go ahead and include your comments.
Yeah, I would agree 100% with Pat. This is a subject that's never come up in any of my conversations, my learnings. I went back immediately and talked to my VP and said, "Hey, I just saw the most interesting presentation." Often people talk about work life for childbearing years, right? That's where a lot of people focus. We need to be flexible. I think this is a group of overlooked, and I just had never had anyone talk about it that way. So I found it just really interesting and a great data point for me.
Yeah, you're really right. I think we look at it from kind of when people are having babies or, working on their families and not really looking at the whole life cycle of women in work. Yeah, that's true. Great,
Yeah.
great point, Tracy. Thank you. Najma, I see your hand up.
Yeah, thank you. I'm Nashma Messiah, and I work at Virginia Mason Franciscan Health. It's my first time at this meeting, so thank you. And one of the things, I love this slide. I didn't see the presentation, but I feel like we have a lot of opportunity in my organization to, one, talk about the women's health and the work-life balance for women, but then also I think we have opportunity to really address the DEI and accessibility. I know that our organization does a lot of work on work-life balance and respect for people, but we do have that gap in really bringing all of these key principles in together. I feel like, is opportunity for us. And so I love this slide, and I've been taking notes and hearing what this group does, and I think it's fabulous. So thank you.
Yeah, thank you, Najma, and welcome. We're so glad you joined us, and we're excited that this is your first meeting.
Thank you.
Yeah, terrific. And just to put a plug in, if you're not hooked up with me on LinkedIn, I do have a group that I host on my LinkedIn, and it's a health industry leadership table. I'll be posting that video on that presentation either today or tomorrow. And then it's a great presentation. It's definitely something to take a look at, Najma.
Great.
So
Thank you so much.
thank you. DeAndrea, I see your hand up.
Yeah, I really liked her presentation. I think there's also a conversation that can be had around women who are waiting longer to start family planning and benefits around family planning for older women, or what they call geriatric, which I think can be a term that is, I don't know, rephrased, but they call it, like, I think, geriatric pregnancies or whatnot. So, yeah, I think there can definitely be a look around that.
Yeah, thank you, DeAndrea. We definitely see people having kids. Not everyone's having, in my lens, the traditional, 50 years ago, when they were so young, either, early 20s or even in their 20s. Sometimes people are waiting to do it later in life, just because everybody has different priorities. But yeah, fantastic point, DeAndrea. So Wendy, I saw you had a comment in the chat. Wanted to kind of open it up to you to talk a little bit more about the intersectionality of that.
Sure. Yeah, I was just interested in one of the questions that came up from one of the participants in the quarterly meeting when she had finished the presentation and kind of opened it up for Q&A. And there was a comment or a question of whether the Women's Bureau had looked at the impact of the topic and older women and menstruation, menopause, kind of, and that experience as it relates to women of color, and just recognizing the disparities that that people experience, and how this additional lens might overlay and create a disproportionate impact in the older female population. So I thought, and she said no, they hadn't really looked at this information and this topic in that way. And so I think it was just an opportunity for her to say, yeah, we should maybe continue to look at it a little bit more closely. That was my my comment.
Yeah, you're exactly right. Because I mean, every culture and every, type of community might have different needs, and obviously there's different gender expectations, just, socially, that we're aware of, even when people come to the U.S., right? If they're, if all their families from another area, they come here and arrive with different expectations and have different mores, and yeah, that was really telling, interesting that they've not dissected that data yet to look at that. So yeah, I agree. And Pat, I just wanted to address your question real quick. You said you meant the slide deck for the AI. I think it was an article.
Yep. Yeah, that would be great. And it was off the subject, so I didn't need for you to address it today. But yeah, I saw it today and I was like, so many people are talking about that, James. And it looked like a really great, I don't know if it was a PowerPoint article, whatever, but I couldn't access it. So I
Oh,
was
okay.
hoping you could send it out to us separately.
Gotcha. Thank you. Yeah, thanks for that feedback. I didn't realize you couldn't access it. Yeah, I'll take a look. If you have
Well,
any,
I couldn't. That doesn't mean that everybody else can. But sorry about the bird walk. I apologize.
no, I'll just mention it. I did put an article into that LinkedIn group. It was about AI and healthcare and just kind of some of the changes. Maybe you're seeing some of that, but some of that is related to some of the things that we're seeing. So thank you, Pat, for that. And I just want to make a note to Veronica. Veronica, I appreciate that you are so supportive of what people are talking about. I see you give your hearts and your comments and talking about that. So thank you for all that support that you're sharing here. I really appreciate it. Um, I'll move on to this slide because I think this is where a bulk of some of that conversation was kind of at. And she really was talking about, women over the age of 55 and in that population. And we can see now that women are working longer than I'll say than before for different reasons, for different expectations. Part of it financial, part of it, responsibility, part of it just, women want to work longer. Some women have to. I mean, there's a lot of different reasons for that. But she was talking about that, 1 in 10 people in workforce are women over the age of 55. And that was really eye-opening to me, just kind of looking at it from that lens. I was like, wow, because all of us here are under 55. I mean, it's just the way we are here. But, everywhere else, I just thought, man, that's such an interesting statistic. And so when we look at kind of the experience of women in workforce, you can also see that in health aides, that 31% are over the age of 55. So that's a third. And when we think about those caregivers in the home with patients or with clients, that's a big population that are aging workforce. And so what do we do for them, right? What do we do for them? And I know there was another statistic that was shared about women, if you think about the course of a woman's experience over the course of a year, it's going to be a lot of money that they're losing because they are taking care of their family, they are taking care of their kids and maybe aging parents even in that household. So here's the statistics. What stands out to everybody else? I mean, those were the ones that were glaring to me. She talked about personal care aides, registered nurses as well. And then obviously, the reasons why people continue working and just how can we make that more equitable? Any ideas on how to make it more equitable for women? I mean, what kind of ideas can we have?
I don't have an idea per se, but I was actually kind of surprised at the RNs 55 plus percentage because that used to be a lot higher. So I think through the pandemic and things like that, like when we were group health, ages ago, our key phrase was like 55% of our nurses are 55 and over, because that was kind of the situation at the time, and I know that was not an uncommon thing. So I think it's interesting to see that we are seeing the population diversify when it comes to age, because it feels like it used to be even more so in that age group, and especially in nurses. So
Yeah, I wonder, I mean, when I think about that 55 and over and maybe kind of, I think well, if you're 55, you're kind of, to me, you're kind of at the tail end of that baby boomer, right? You're kind of in that transition to Gen X, and so it definitely, you can see a lot of that exodus of a lot of baby boomers leaving the workforce. So I wonder if that's part of that statistic that you were referencing, because Angie, 55% over 55. Wow.
Yep.
I'm like,
That was
wow.
the group health nursing workforce. That was about 5 years ago, but yeah.
Yeah, that's kind of shocking even to me. That's a high percentage.
Super high.
What about everyone else? What else stands out in these statistics? Or what do you think these statistics, you see it in your organization or in your environment as well? A lot of aging, people working longer, women working longer and staying in the workforce. Yeah, Stacy.
So when I look at this, one of the things that I think is about its intersectionality again. So home health care, having exposure to the folks who do those jobs, I'm always amazed at what a high percentage of women are not only older, but we have an amazingly high percentage of people who are not Caucasian or necessarily born in this country doing this work. These women come and they're doing this amazing work, and it's so difficult and can be very physically taxing. So when I think about doing that, past the age of 55, it really feels like there should be ways to support that population differently.
Yeah, you're right. Yeah, over the age of 55 and doing all that work, and you're right, it's not easy. Because usually you're working with, obviously, with people who need, I'll say, more help than you, right? Who maybe aren't so ambulatory or able to kind of get around, and their gait is unsteady. So yeah, I would agree with that. Lise, I see your hand up.
Yeah, thank you, Stacy, for bringing that up. I just wanted to echo that point, and Veronica's point about working in the social services too. We see a lot of overlap with this women over 55 in the workforce. Sure, that's retirement age, quote unquote, but having the long-term resources or time in a position that afforded those savings accounts is often the part that's a big hurdle. As we've encountered in our program, women looking for work in the healthcare arena, in non-clinical roles or billing roles, because they're supporting their families still, or their partners lost their job, or their kids have moved back in. Those are a lot of the reasons that we see women over 55 looking for work via our program.
Wow. Yeah, thank you, Lise. That's really interesting to kind of see that, and especially in our little ecosystem here in Washington. At least I imagine that was Washington based, that idea. Okay, I didn't know if you were talking from a national perspective, but yeah, we definitely see a lot of that happen. And Renee, thank you so much. The youngest boomers are 60, and I think where I was coming from is my brother's 56, and it seems to me like he has that traditional work experience where he's worked for a company for 30 years and now he's retired, and just it seems like some of those. But yeah, no, I definitely can see that the youngest baby boomers are 60 and Gen X is a smaller generation with that. So thank you for that. Najma, wow, your mom, your 75-year-old mother is still working.
Yes, she is. I want her to retire, but she works in nonprofit and she works for Spokane, as a matter of fact. So but she's adopted my niece when she was just an infant, so
Wow.
but I know she's doing great though. She's doing great.
Yeah, I mean, I do know some people that are, up in age, and they do, some people, I don't know if this is more mandatory she's working or it's a preferred, but some people like to stay actively involved in kind of what's going on. And, I will say that sometimes when I see people retired, it seems like, obviously their life changes in different ways. And so, yeah, definitely an aging workforce with that. And then Najma, you brought up an interesting part. There was also the mention as well about older people taking care of younger kids. Right. So sometimes it's the grandkids, or
Yeah.
in my experience, it was the great grandkids, right? That the grandparents were taking care of. So yeah, there's a lot of that kind of happening as well. And especially with the economy, the way that it's going, it's not always easy. Obviously, if the parents are both out there working and maybe an elderly parent is taking care of some younger kids in that situation as well. So
Yes, that is exactly what's going on in our family. My um um she's had my niece since she was 2 weeks old. Her parents were, homeless and on drugs. And so so she stepped in and has been taking care of this little girl who's now my sister. So I call her my sister niece. But and I would assume that, that happens a lot in the BIPOC community as well. So
yeah, thank you. And then thank your mom for stepping up. I mean, that's not an easy thing to take on. So
right. Thank you.
So one of the areas that the presentation focused on was also the menstruation and menopause at work. And I think this talks a little bit about some of that experience for women in the workplace, right? And she talked about, having, adequate spaces for women who need to have like access to a bathroom and easy access and flexibility with work. And I think Stacy talked about that point 8, whether that was something that was needed for a family or maybe something more physical needs, but also the menopause at work too, because as we have this aging population happening, what accommodations could work have in place to make it more conducive to support women going through menopause? So I'll open it up here for people to kind of give either their ideas or maybe something that your organization is doing already that we could learn from. Or, hey, it'd be nice to have this. I mean, because I think this is really that safe space to really share some of those things. And it would be great to even continue on these conversations even afterwards. So what would help, what would need to be in place or what is in place already that's been helpful for that experience?
I think it doesn't necessarily pertain to this, James, but it has been really helpful in our workplace has just been a quiet room or just a room where you can go close the door, turn out the lights, relax, take a nap, whatever you need to do. And I've seen that in my last 2 organizations, whether it be for nursing moms or a headache or anxiety, whatever. But it is, I would think, would be also very helpful to women going through menopause and menstruation at work. But it's something so simple that really anybody can implement. And very few people take advantage of it. But when you need it, it's there.
Yeah, thank you, Pat. And you brought another topic as well about breastfeeding or doing some of that care for babies. I mean, that's another part to it as well. I think in having some of those private spaces. Thank you, Pat. That was really
Yeah,
good.
and there's someone also in our organization that's prone to epilepsy, and so they probably use it more often than not. I know I've used it for sugar issues, like when you just need a minute to just be out of sight, out of mind, or you're just exhausted for the day and you need an hour in the afternoon. It's just really helpful. So again, something so simple and so easy to implement. If you have a space, you can make it a quiet space.
Terrific. Thank you, Pat. Some other things that she talked about in the presentation was access to temperature controls and maybe having fans available, for people that might need that, or having easy access to windows, just to kind of keep that circulation. She also talked about uniforms, and I think there was something referred to white uniforms. I think historically that has been kind of a color used obviously in hospitals and clinics and those kinds of things, but sometimes that can be very challenging, obviously, to keep white. No offense, you will rarely ever see me in white because I can't keep white clean for anything. I just, not a shirt, not pants, I just can't myself. So I'm always amazed when I see people wear white because I'm always thinking about all the challenges with that. But once again, when you look at it from a medical staffing perspective, that's even, a different type of experience to have. So she talked about that, and then obviously training for managers, right? So not only should this information be here in this discussion, but how are managers being informed to care for their employees in that supportive role there, and not just being dismissive or, you know, oh, you're acting this way again, or however that might come across differently, but really, you know, training for managers to really be supportive for that workforce. Because she talked a lot bit about retention, right? How can we retain employees that are having some needs that we're not quite addressing? So I think with Pat's example with that, you know, room, that's a great, easy, you know, option to offer your employees for them to have a safe space to maybe who need to kind of unplug for a little bit during that work for whatever reason, but as well as just making sure that, you know, we're obviously being supportive in that. Any additional comments regarding this part? Because like I said, this was kind of that, I'll say, denser kind of topic that she was really addressing, in which I've heard in this conversation, everyone was glad she was bringing it up, right? Because we've not heard these conversations in public forums or in a meeting or even as an issue to talk about so openly. What kind of sticks out to you here? Oh.
I would just say, James, exactly what you were just saying. I mean, this has been like taboo. Like you don't talk about menstruation, you don't talk about menopause, you don't talk about those women things. And so I love the fact that, you know, these conversations are happening more and more. We're even starting to hear like radio shows and commercials. I saw a commercial for hot flash medicine the other day. I was like, what? Like, you know, it reminds me of, I know this is dating myself, but it's reminding me of the first tampon commercial that you saw on TV, right? Because that, many of you might not remember this, but that was just like, oh my God, they're like talking about your period on TV, like it was a big deal. And so I think about that period of time and to now, and the evolution, right, of basically humanity and thinking and understanding people, you know, and the things about our bodies that make us people. And I don't know, I get excited, and I know that this is still really early, so I just think about what's it going to be like in another 15 years, where all this is just normal conversation, and these are just things that we automatically, you know, take into consideration as we are providing the best environments for our employees to work in. So I just wanted to give that comment, because I just think this just feels like another stage of that evolution, which gets me excited about.
Yeah, definitely.
People.
Thank you, Angie. Yeah, no. Well, and with your comments, and then when I think about healthcare, you know, 75% of the workforce is women. I mean, wow, that's just the need is there, we know, for women generally, but then you have 75% of your workforce that have that need. That's even stronger, right? And obviously a great need. So yeah, thank you for that history as well, because there have been a lot of changes that have happened in the conversation, in the culture, in our mores, and just the way we interact with everybody. Yeah, Stacy. See your hand up, and you're on mute.
Thank you. I was looking at the chat and I was thinking, you know, it is interesting because the desire to work virtually, I think, is something. And so a lot of times when we're thinking about accommodations or workforce or supporting people, it's trying to recreate some of those benefits. Like the quiet room is, you know, to the point of the chat, it's like working from home. But in healthcare, we have patients or clients, and you know, it's not, we need actual people to take care of other actual people in many instances. And so it's not possible to have people work virtually, but to try and replicate some of those things that might be successful about working virtually, like a quiet room. I love that idea. I think, you know, like we have a 64-bed residential treatment facility, and just a place where you could step away just to have a quiet moment would be a really valuable thing to our staff for many reasons, right? Not only for, I mean, you know what, hot flashes are a real thing. And if you could just go in a room and shut the door and wave your face wildly and not have to explain it to anyone who's 25, that would be a huge bonus at work.
Explain it to anybody who's 25. That's funny.
Yeah.
Yes, the natural cycle of aging, for sure. Thank you, Stacy. Yeah, I really appreciate that comment. And you know, Renee, I'm gonna ask to see, I don't know if you have the ability to come off of mute, but you've been putting in some fantastic you know, little data pieces and you know, talking about data. I wondered if you could kind of, you know, what are your thoughts? Could you comment a little bit more, add a little bit more context to what you're sharing in the chat?
Sure thing. So that was, I spent some time on this topic researching as part of the council report this last year because we had focused on childcare access as a key factor that was limiting some people's ability to come back to work. And I was having to reconcile that with Department of Labor data that was showing women participating in the workforce at higher rates than pre-pandemic. So, when you get data like that, you're like, what's going on? So there was a whole deep dive I found, which I think it was the Hamilton Project at Brookings, that was sort of subdividing that by a bunch of different categories. And really the gains were coming from women college educated. So sort of bachelor's level and higher were coming back to the workforce, whereas women from immigrant backgrounds are below pandemic levels of employment, and some other groups too. I'll see if I can run it up real quick, just because it's interesting reading for those who like that sort of wonky national data trend side of things.
Terrific. Thank you. Yeah, really good input. Yeah, and then she did mention the UK, just kind of, they're a leader in some of this areas. Obviously, we can look at some of the ideas that we have about the UK being a little bit more forward thinking in some of these areas as well. So, yeah, thank you, Najma. Thank you for joining. So that was a really good part. And then, looking at mothering and kind of the things that we do as women for our families, and just looking at that unpaid type of support and service, and how much money a woman might not gain from working when in fact they're taking care of their family. And I remember some of the discussions when I was in high school, just talking about a woman's not necessarily unemployed when they're taking care of their house, but they have a lot of other skills that they're bringing in, right? They're managing a budget, they're doing behavioral health and mental health with their kids and families. And there's a lot of I'll say sometimes expectations from women in a family, right, to kind of take care of everything. I mean, we kind of saw that actually during COVID. We saw a rise in some of that domestic violence, just because everyone's home, but yet the woman was still kind of expected to kind of maintain a lot of those things, and also actually do a lot of that education at home with their kids. So when we look at kind of all the work that women do, they're unpaid wages, right? They're paid with, people saying they love you and they care for you and those kinds of things, but there's not really this monetary banking of funds, especially for retirement. And that's the part that really got me, is when I think about retirement, it's, man, if you weren't able to work and do all those things because you have a family, because you have needs, and let's if you have any families with special needs, then there's a lot of missed, income that could have been gained through that. And then I know we heard from Najma about her mom being 75 years old and still working. That was kind of interesting as well. So Renee did just put something into the group chat, just so you know. It's the labor force participation of prime age women whose youngest child under 5. So you can kind of look at that statistic as well. Any additional comments regarding this slide? Okay. We're going to kind of we're almost wrapping up here, looking at through a gender lens. Obviously, looking at things that we have. I think there was a comment that was really striking from our speaker that talked about, if you're an alcoholic or if you're a drug user and you want to get better, there's programs in healthcare that can help you, and it's actually part of the support that you receive from your employer. So there's all these systems and programs in place. Yet, if you're going through menopause or even periods that you need additional physical support and medical care, that there aren't all these things kind of in place. And I think, just as Angie talked about, this topic was historically taboo to even kind of bring up in a conversation. And so hence there was just kind of this need that obviously is there, but no one's really addressing it. So I think that was really striking as well, because we've embedded some of those other things in systematically, yet this is something that, once again, 75% of the workforce, aging women, a lot of different experiences are happening. Yet what are we doing from an employer part to help support our employees who have those needs? So what other comments do you have regarding this slide? or looking at other issues through gender lens. I think that was really telling, because I think that was something that I know we talk about at SJI now is, through a gender lens, because sometimes, we look at it through just one lens and kind of lump everybody into that one group, right? So maybe not being as discerning as we could.
I will say, James, this is something I'm so unfamiliar with. Like I guess I'm just thankful that it's coming to light because I'm so naive about it. I'm just so naive. And I just think if one person's naive and there's more training around it, it's necessary because I'm guessing other people are as well.
Yeah, yeah. And the big part here that we can definitely glean is the first part, right? I mean, 73% of all non-fatal workplace injuries and illnesses due to violence in 2018. And that's healthcare workers. Wow. I mean, when I saw that, I was like, wow. I mean, all non-fatal workplace injuries, I'm assuming that's all workplace injuries, and 73% are in healthcare.
Is a huge number, right? And yeah, that's what I'm saying. I'm so naive to this information that I feel like anything that can add to the scope of what I don't know is helpful.
Yeah, and I think through that conversation as well, I think some of the ideas were, what could be done, right? What are the things that we could be doing? And she did mention a lot about recommending signage, right? So signage, just talking about violence and how it's maybe not tolerated, or these are not supported, or maybe, here are principles which are talking about maybe, good interactions and good communication. She talked a lot about not working in isolation. So structuring work so that a person is not by themselves with someone who potentially be violent with them, and obviously keeping those groups kind of more open. She kind of mentioned a little bit also like after work events, that would be something to kind of just be aware of who's there still. And then really making it acceptable for workers to say, this is not acceptable, and being supported in that rather than, oh, just deal with it, right? Rather than that kind of antiquated statement of, hey, that's just the way the work is. I remember hearing that as a kid sometimes too. So not just being okay with the status quo, but really challenging those systems to say, this is not okay. We need to talk about this and really address this, and what solutions can we come up with.
And I want to say too that number two, like that recognizes healthcare services and hospitals as high risk. Again, something that never even entered my brain, but I was like, of course they are. They have the most vulnerable people. So of course they are, but it's just something that just never occurred to me. And I feel very ignorant saying that out loud, but I just feel like if, it's just, I think it's something really good to bring to the awareness of the public.
Thank you. Thank you, Pat. And this issue was a little bit brought up even last quarter, last year by one of our HILT captains as well, because that was something she was noticing or getting feedback in her workplace as well. Is just that, patients were being, harassing some of the healthcare workers that were there supporting them. And so that's kind of brought some of the alert to us in the convening team and in the HILT captains to really start exploring this a little bit more. And hence we were able to hook up with a great speaker like we had with Kelly. But you're exactly right. I mean, these are all really important topics for us to be very aware of, and not just talk about them one time and kind of a one and done, but really continue dialoguing this out, because I think when we're post-COVID, we see some of the things that have changed in our workforce, but also how can we keep our workforce? I think we do a great job sometimes of attracting people to an industry, but then once they're in, what do we do to keep them, right? And even keep them for the duration of their experience as well. What other things are coming out to people's minds? I mean, what other things were standing out either about the topic that we're talking about or the presentation that she gave? I know I've got lots of good information as well. Well, these are the questions that she had that she wanted us to talk about kind of in that larger group, right? And then once again, from that gender lens. And I think that's the part that's been sticking with me quite a bit. It's just really expanding the way that I look at things, not only from my view, but obviously incorporating other genders and orientations and lifestyles and so forth to make sure that we're being equitable with that. As I mentioned, I do think of maritime as well, because, SGI, we do support maritime conversations, and this has come up in that conversation as well. And I know when it came up to talk about needs of women who have periods, or we didn't talk about menopause, I mean, admittedly, but more about just those basic needs that women need, and not making those assumptions about gender on a ship, right? So I think about that from this sense, about just making sure that we are being inclusive and not just looking at it from one perspective, or being dismissive with that. Which question here speaks to you? Which question do you, when you look at it, do you go, man, like that's kind of the one that really kind of sits you up a little bit straighter and kind of perks you up? And which one would you say was be an important part for your organization or in your lens? So which one? Yeah, Stacy.
So I kind of go right to the second one, because it's not only women, but in the behavioral health field, or maybe just in my organization, we have a lot of folks who are non-binary, and we have worked really, really hard to make our workplace be accepting and supportive, sort of across the range of identification. And so I think for me that has been something that we have worked on pretty diligently at my org. And so, I'm always interested we always want to know how successful we have been. Are there other ways we can make it a supportive environment for all?
Wow. And how are y'all addressing that? I know you said y'all are working on it. Like, what can you share any of the work or strategies, or an example or something that we can kind of piece it together for us?
Yep. I mean, we've done things in our lobbies. We want our lobbies to make sure that you feel represented when you walk in. So
Okay.
LGBTQIA plus, we have lots of sort of signage and symbols and things in our lobbies. We have an electronic health record that only will display legal names. So we've had to do this big workaround so that we can make sure that we've got people's appropriate pronouns, their preferred pronouns available, and that if there's a dead name, that there's still the legal name, that we figured out how to make it so that they don't get addressed that way when they're checked in. We've worked really hard with all of our team members to use really neutral language, because if you don't, we do not want to re-traumatize somebody when they come to our organization for care. So
Yeah, those are great examples.
yeah, it's always an ongoing struggle. I think the other one I will share is that because we report up through Medicaid a lot, we have count them four choices in gender, and people find this incredibly offensive. And so we go to our funders and we say, hey, could we have more inclusive categories? Nope, they say you cannot. So, I mean, so we figured out ways to let people express their gender in the way that makes sense to them. And then we report it up as best we can. And there's a lot of feeling about that still not appropriate, but you know what? I can't change federal definitions. But I think those are just some of the ways in which we continue to struggle.
Yeah, Stacey, what I really like about what you said is you're continuing on the training and conversations. I mean, it's never a one and done, right? It's not like you do it once and you're good and we're gonna go. It's this continual attention to it in the manner that people need to either show up, be respected, and then obviously be open to other people's differences. So absolutely. And you also mentioned patience. I really, I think from here I was kind of looking at it just from a workforce, but you obviously want the patients to feel when they come in that they're not being siloed or pegged in a specific perspective, but that they're being respected as well as a whole person. So I think that's really important.
Yeah, it's about team members and clients. It's the whole across the gamut.
Yeah, I could see that being a good thing for all of us to kind of note. I mean, and the one thing that I'll say, with what the speaker said was signage, right? And I think Stacey, you talked about that. People being represented, I don't want to say on a wall per se, but in some kind of display or there's something written that is visual that people can obviously identify with. And it doesn't always have to be, overtly spoken about in a sense, because not everybody does that, but people, it needs to be represented to make sure that people are being included. Which other ones kind of stand out to people? Which one, when you look at this list of four, conversation and discussion questions, I mean, which one speaks out to you? And I'm going to see if I can enlist the support of DeAndrea, who works with SJI, my organization, because DeAndrea has a lot of good experiences in these kind of conversations. I'll say, because we were able to hook up with the speaker, because DeAndrea also hooked up with the speaker as well to come in and try to do a present. Or she did a presentation for one of our graduating classes, and that was really well received as well. But in that, we were able to kind of keep going with the conversation even here in the HILT. And DeAndrea, can you come off of mute and share your insights?
Sure. I would say, well, based on our participants and just maybe what they have shared, what I find is that there's a lot of immigrant and refugee population that go into healthcare and report a lot of violence, where it's almost kind of shocking the amount of violence that they receive from patients. And it kind of seems like it's just the norm of what they're supposed to put up with because they get the opportunity to be employed. Um, so definitely an area that I recognize, and we have conversations with our participants about what is appropriate as far as like, yeah, they're not going to feel well. Patients aren't going to feel good, but you don't have to dodge blows at work. You shouldn't. So that's one area. I would say, let me see. Even with, and I don't know much about this area, but I would just consider we have a high population, Muslim population, and just considering what that looks like when we're speaking about, private areas and, for women and what that can look like. So those are some areas.
Yeah, thank you, DeAndrea. Yeah, when I
Mhm.
think of immigrant and refugee populations, I mean, I could see them, being excited to complete a training and then obviously get a job, and there they are working. And if these kind of pressures kind of come in, it's kind of a double-edged sword, right? You want to advocate, but maybe you don't understand that, you're maybe you are in an environment where you'll get kind of some punitive reactions from either managerial or employees or something like that. But if you're not aware of how things work necessarily in the way, human resources support can work, then maybe you think, oh, I just have to kind of take it or survive. So yeah, thank you, DeAndrea. That's a really good point. And Dan did mention in the chat as well that they are hosting a community listening session in June regarding health workforce development. And he was talking about kind of including some of these questions in that dialogue as well. So thank you, Dan. So where do we go from here? Where do we go from after this great discussion? What should the HILT do? What would we recommend? And then the other questions I've got are, do we see this coming up with if we're talking about women's experience and kind of the life trajectory of women and experience in workforce, what do we do with this information? How can we help educate, students that are in training to become these professions? How can we make it better and for them? Because once again, we can do a great job of recruiting. We can bring all the people in, but unless we have the place for them to feel safe and to feel productive and be a part of the organization, then they might just leave. And do we think that the perception in healthcare has changed? I mean, for those that work kind of in the training spaces with students, I mean, what do you hear out of those students about the perception of healthcare? Do they have ideas that it's just, this great euphoric kind of, work environment? Do they have concerns? Have they heard things, kind of maybe related to some of these topics? What's the sense of students kind of coming into those training spaces?
If I could say, I think, well, I think since there's a higher level of like exposure because of like TikTok and YouTube and all of these different social media avenues, um, and when COVID happened, it did expose a different idea about healthcare. I think at one time, healthcare was like considered like the creme de la creme. But then when you have nurses who are getting on TikTok or Facebook and saying, this is what's happening, or somebody's videotaping their experience in healthcare, there's a higher level of exposure as to what it is really like on the other side of things. What you don't hear about in the presentation or the job offer, or somebody who's supposed to tell you is great. So I think just considering that, and that there is this reality that people in general, even outside of healthcare, are now looking at work-life balance. And does this align with my values? Particularly those coming out of, I would say, high school and things like that. The generation that is coming in are really asking questions. Does this align with what I value? So I'll say that part.
Yeah, Deandra, you brought in social media. Wow. TikTok videos, and I guess I never thought about it from that lens, but you're right. That's how sometimes that information is kind of dispersed, right? So people are learning about that industry as well. Um, any other feedback from people about what you're hearing from, young people wanting to become, join the medical profession, or what's the sense that, because I feel like we're already kind of in it, in the workforce and so forth. So what are we learning from people that want to join the workforce? And Stacy, I see your hand up.
From the behavioral health side, we tend to get people who are very idealistic and they want to do good things and they want to help people. And then the reality of actually working with actual people who are struggling hits them. So we have sort of a bifurcated response. We have people who really dig in and who connect to the mission and are able to work through some of those difficulties about once you understand what that is really like. But we have a large number of people who give it a shot and then decide this is ultimately not a business that they want to continue in. So I think it is really about understanding the reality of the work in the behavioral healthcare space, particularly from a publicly funded not-for-profit agency.
And you think that would just be done perhaps like in, discussion, just conversation, or, is there anything that you think we should be doing more so to help educate young people?
I think it's a delicate balance. We always want to be real with people about what they can expect from the work that we do. But I also think that we can work really hard to help them connect to the real sort of the value and the joy that can grow out of the work, even though it's not a short-term, immediate kind of gratification often. But if you look at it across the long run, it is really rewarding work. And so I think it's helping people take the longer view.
Okay. Yeah, no, I could definitely see that. Lots of good input. Thank you. Pat, I see your hand up.
Yeah, and I'm trying really hard not to talk as much because I know I've shared too much today. But this is something that's near and dear to my heart.
Okay.
It's really interesting because I was with Clover Park for 9 years and I recruited for the LPN to RN to, or CNA to LPN to RN programs and many other healthcare. We had substance use disorder professional when it was called something else, CDP, chemical dependency professional. And I agree that it was, students were very naive coming into what they were just kind of in the pink cloud mode of after, maybe in 6 months of sobriety and thinking I'm going to save the world and that. But I've had the opportunity with this job to really work with Health Occupation Students of America from the K-12 systems. And I just had a really nice conversation with them at their with many students at their leadership conference in November on the Southwest side. And what I found was really interesting that came up again and again and again was the students kept saying, where do we get this information? We get to see our counselor 1 to 2 times in our, junior and senior year. We know that school counselors are spread thin, right? Not everybody has the resources, the access to talk about CTE programming or really put CTE programming in front of the students. And so it's really interesting how like some students came to me and said, well, what if I want to be a mortician? Or what if I want, they have some ideas of like what they want to be. But they don't know what to do from that point. They don't know where to get the information. And so I introduced them to a little tool, which many of you know probably is called ONET, where they can get in and research their chosen profession, find out how much it pays in Washington State, find out how much, exactly really what's expected in that profession. And just that was just so exciting for them to like be able to have an application that they could get in and dig deep. And again, so many of these high schools maybe have access to this. They have the resources to provide an application like that. But so many of them in the rural and urban underserved areas and really rural areas do not. They have one counselor. So I think that's the really tricky part is like, how do you get them to maybe you're not a CNA, maybe you're not an RN, but what could you be if you're interested in healthcare? What's another option? And I spent 9 years at Clover Park telling students, if you don't have this ABC personality trait, why don't we look at something else? Well, I don't know. I've always wanted to be a nurse. Well, have you thought about this, or have you thought about this? And they hadn't. They really hadn't, because their mom was a nurse, their best friend was a nurse, somebody was a nurse, and that was the only focus they had.
Right.
So how do we really get a student to, okay, this is, to unnarrow their pathways, I guess. Yeah. To diversify their pathways and really think about it, and then have the access to know where to go from that point.
Yeah, great input regarding rural communities. And if you think about a student with one counselor and maybe they see them once or twice that year, let's go even 3 times, but where are they getting that information, right? And I think to DeAndrea's point, a lot of times it's going to be on social media, right? Because that's where their attention is kind of focused on a little bit. So, wow. Yeah, just really enlightening conversation, even for me to kind of keep thinking about these things. I will say that, Renee was, she made a comment about aspiring morticians. So, that's kind of interesting as well, that people are, I always enjoy the fact that we all have different likes and dislikes and interests, because once again, we need aspiring morticians, right? I don't want to be that, but it's good that there's other people that want to do those things. Renee also shared the Career Bridge as another statewide resource, and she provided a link in that. And then Renee, you said we were revamping it to be a stronger website currently, but works as is too. Anything we should know about the Career Bridge website, just out of context or for this group?
Sure. So this is part of a packet of statewide information, along with the brochure that's there, the Where You're Going that's linked off, that goes out to high school programs across the state. And it's not healthcare specific, it's broader than that. But it gives people a place to start. And actually I was curious, so I typed in mortuary into the Find Education. So now I can see that there's Lake Washington Institute of Technology has an 18-month funeral directing and management program, and it's like, oh, well, that's a place I can go find out more about that. And then we don't have performance results for that particular program, but it does create an entry into for the range of what's out there. And schools, it has a mix of public schools, private career schools. People want to be on here because it's part of the eligible training provider list that lets them access federal, like VA education dollars.
Okay.
So that's the reason why people put their school information on here. And it is an old site. You'll see that when you go visit it. So we also have a state appropriation to make it better. But it is there now too. It's not perfect. I'm not going to say I've got the best whiz bang website in the world, but it's We'll try it.
That is amazing. Thank you, yeah, for that great resource. I mean, it definitely seems like something that we could all use. And, you know, and I think that's part of the event that we're doing that's coming up, the Sound Careers in Healthcare event. That's one of the things that we're doing as well, is trying to give students that real understanding, not only of the work, and maybe not some of all these areas, but obviously people sharing their experiences and what they like and maybe don't want so much in healthcare. And then I did just include the AI article, Pat. I was able to kind of find that and included that. I don't, if you want to try just downloading to make sure you can get that. Thank you for the feedback regarding the LinkedIn. I will look more into that as well. And final comments. I mean, we're kind of coming down to the close of this discussion, and fantastic discussion. I want to thank everybody in advance for really bringing, you know, a lot of good examples and ideas. And what I enjoy about this conversation is we took it all the way from, you know, students who are interested to join healthcare, all the way out to the, you know, the very, you know, late experience for people 55 and older. So looking at that experience. So really rich discussion, and something that I want us to continue talking about. Where do we go from here? What do we recommend? What any recommendations of, you know, do we just keep talking about it? Do we create anything for it? Is there, you know, something for us to recommend? You know, what, or do we, you know, maybe you also need some time to maybe think about it, because it's kind of a dense topic in that sense. You know, really want to still continue on these dialogues, but really not just kind of only, you know, have the discussion, but really, I think to a few different points is, you know, if people started including a quiet room in all their different spaces with a fan, with some of those things that we know that are needed, that would be something good as well for recommendations for those workplace facilities. Where do we take it from here? Hearing no one, I'm gonna say that we can think about it, and let's go ahead and take this all back and kind of process it a little bit. I think it's a very dense, you know, rich, meaty discussion, and so I think we can take back these ideas and comments, and really, if you come up with ideas on how to really continue moving this forward, not only, you know, involving the presenter, I think we can continue these discussions as well, but really, how can we kind of embed that in some of the work that we do, and with the HILT as well. So really appreciate everyone's time. Thank you so much. Yes, let's keep talking about it for sure. Thank you, Pat. Let's definitely keep talking about it. And like I said, the part that is going to stick with me today is the fact that somebody said, and Pat, it may have been you, or maybe it was Angie, that said, we've never talked about these things. These are some of the first times we're talking about it. And it's kind of like, wow, these are the first times we're talking about it, which is needed. And we need to continue expressing this out. So really appreciate everyone's support and effort. We will see you at the next Sound Careers in Healthcare event. That's just less than 2 weeks away. Or 2 weeks away, exactly, because today's Thursday already, man. But have a great weekend, and we'll see you at Sound Careers in Healthcare. All right, thank you, everybody.
Looking forward to it, James. Thank you.
Terrific.